Ocrevus is approved for the treatment of relapsing and primary progressive multiple sclerosis. It is a B-cell depleting therapy that targets CD20 B cells, though the timing of B-cell repletion and the relationship between disease breakthrough and MS is unclear. The prescribing information states that B-cell counts rose above the lower limit of normal in between infusions of Ocrevus at least one time in a small proportion of patients, with the median time to return of cell counts at 72 weeks. The degree and incidence to which B-cell repletion occurs with ocrelizumab has not previously been reported. ACAPELLA is a prospective observational study assessing adverse events in a real-world population. In addition to the collection of infections and other serious adverse events, CD19 cell counts were collected as part of standard pre-infusion laboratory assessments. The population of interest is a subset of the ACAPELLA study that received more than one treatment. In this subgroup of patients, there was a varying degree of repletion, and we defined categories by stratifying the amounts of absolute CD19 cell count seen at the time of the patient's next infusion. These subgroups were defined as non-repleters, mild, moderate, or as marked repleters. The patients defined as mild, moderate, or marked repleters made up 24.6% of the total population. These subgroups showed some degree of repletion at one or more time points between Ocrevus infusions. Of our marked repleters, 5 had values of absolute CD19 cell counts returned to the normal range between infusions. Non-repleters did not show an increased risk of infection. At the time of the second cycle of Ocrevus, 27% of the patients were mild repleters, and 7% were moderate or marked repleters. Mild repleters were more likely to become non-repleters with each subsequent infusion, suggesting that ongoing exposure to Ocrevus results in cumulative depletion, where moderate or marked repleters were more likely to remain repleters with subsequent infusions. Though our population was small, repletion to any degree did not correlate with MRI or clinical disease activity. There was no correlation between B-cell repletion and age, EDSS, or prior immunosuppression. In this substudy of the ACAPELLA cohort, we attempted to characterize B-cell repletion in a real-world population treated with Ocrevus. While CD19 repletion may correlate with disease breakthrough in other autoimmune conditions, its role in Ocrevus-treated MS patients is less clear. In our study, we did not observe any correlation between disease breakthrough and B-cell repletion, suggesting that it does not necessarily herald clinical or radiographic relapse. Other patient characteristics, such as BMI, smoking, and race, may influence B-cell repletion. The timing of B-cell repletion is also of particular interest. Though these were not addressed in the present study, we aim to have these factors assessed in future studies.